Well, as Dave mentioned earlier, we're going to petrify you about a disease that a lot of people are walking or hobbling around with. In fact, 80% of Canadians don't even know they have, but 25,000 hips are going to fracture this year because of an underlying disease called
Osteoporosis.
That's right.
That's right. Now, I have a cat. I also have a dog. And this cat, he gets on my chest sometimes and he just kind of kneads away and he purrs. And then the dog comes in and this cat just like this and turns my chest into a hamburger helper as it leaves. But why is it that all cats, with the exception of tigers, purr? And the answer is because they are trying to stimulate vibration to strengthen their bones so that when they fall off the 9th floor apartment buildings, they don't break their bones very often. We have a hard time purring, so there are other things that we can do to prevent osteoporosis. As mentioned by Dr. Seeley, there's 60,000 backs that'll break in Canada this year. Quite a few thousand hips will fracture. Some of you listening probably sitting there ready to have a hip fracture. It's because your skeleton is about to turn into eggshell, easily broken, easily destroyed, and often broken before you even fall. So before you turn into chalk, do a few things to prevent the osteoporosis. Now, there's risk factors for osteoporosis. The major risk factor is if your family, it runs in your family. So if you have that in your family, go get some new parents.
That's what I would do.
Absolutely. What are some other risk factors, Rob?
Well, if you're inactive, you have to be active. A weight-bearing exercise, if you're not taking enough vitamin D or calcium in your diet, if you happen to be an astronaut.
Yes.
Astronauts are at high risk. So,
all astronauts out there, pay attention.
Yeah, you could be high risk for osteoporosis. So it's important to check that out. Now, again, it's silent. A lot of things we talked about before, like hypertension and kidney disease, are also silent. So it's important to get a proper check. Now, go see your physician and see if you qualify. You have the criteria with these risk factors, as Dave
including
mentioned.
being over the age of 65.
That's
so
right.
If you're over the age of 65, quit. Stop it. Go back. You're in the wrong area.
But you should have a bone density test.
Yes.
Okay, it looks like an X-ray. I mean, you would think it's just a regular X-ray, but it takes a picture of your hip and your lower back, and it'll tell you how dense you are. And looking at you, I know that, yeah.
Fairly dense?
Fairly.
Thank you.
You're welcome.
How about smoking, Rob?
No, thank you.
No, smoking is a risk factor. Thyroid, if your thyroid's too active, it's a risk factor. So everybody within the sound of our voices should be on vitamin D supplementation and calcium. Again, having calcium without vitamin D is like fishing without a hook. It's not going to work. And even more important than calcium is exercise. So how much vitamin D should you have, Rob?
Me?
Yeah.
I'd say about 1,000 to 2,000. Probably 2,000 units of vitamin D, they're saying nowadays, is appropriate. It used to be 400.
Yeah, and now 2,000 is nothing. So, and also the calcium up to 400. So listen, if that doesn't work, then you better start purring, right? Can you purr? Can you purr?